So why do we need teriparatide in osteoporotic patients and which underwent fusion? So there's a lot of incidents of cage subsidence, pedicle screw loosening and screw back out, fragility fractures, pseudoarthrosis and PJK. If these patients have a low BMD, particularly this elderly postmenopausal women with osteoporosis. So all these factors are challenging. So I'll show you some cases. This is some patient, elderly female patient, L3-4 spondylolisthesis and L4-5. We had done a minimal invasive fusion, and there was screw back out of implants at the L3 levels at 3 months post surgery. So we had to go and revise this patient at 3 months, and then we started our own biologics along with teriparatide, calcium, vitamin D, and as well as biphosphonates to improve the BMD. So another patient, this was referred to us with she had an intraoperative fracture, L5 fracture, while spontaneous fracture while doing the MIS TLF. So you can see in this MRI and the CT scan, there is a spontaneous fracture while just putting the screws. So this is what can happen in elderly postmenopausal females, and we had to go and extend the fusion from L3 to the pelvis. Another complication we have regularly seen in this postmenopausal women with osteoporosis is end plate fractures. They can be iatrogenic or spontaneous end plate fractures leading to cage subsidence, and that also leads to pseudoarthrosis and increased pain postoperatively. So these patients are challenging. Another patient, we had done this, she had a 68-year-old female, she was CKD, minimal invasive TLIF was done for L5S1. So everything went uneventful. 2 weeks post-operative, she had a spontaneous fracture of the sacral promontory and had severe pain and implant back out at the level of L5, S1. And we had to revise this patient. So osteoporosis can be challenging in elderly patients, particularly with postmenopausal osteoporosis and patients with comorbidities like CKD and all. So there has been a lot of research showing that the intravenous zoledronic acid plus teriparatide in postmenopausal osteoporosis women improves the BMD significantly. So this is a chart where it suggests that improvement in mean BMD with zoledronic acid alone and with teriparatide and combination of zoledronic acid and teriparatide. So combination of biphosphonates and teriparatide does improve BMD in osteoporotic patients in these elderly females. So patients who are with diagnosed low BMD score preoperatively, it's good to supplement with them with teriparatide either preoperatively along with postoperative supplementation. And there is enough research to show that teriparatide is effective. Parathormone has potent anabolic effect on bone remodeling. Intermittent parathormone treatment increases bone mass and reduces the risk for osteoporotic vertebral fractures, and also increases the quality of bone cortex and cancellous bone. We also conducted a study on our own patients where we compared our patients who received teriparatide, who had BMD score less than 2.5 and patients with non-teriparatide group. And we assessed the outcome scores at 12 and 18 months of follow-up. And we did see actually good results in these patients. So out of 102 patients, 78 patients had osteoporosis with a BMD score of less than minus 2.5. Out of the 78 patients, 61 patients were included, 27 patients in each group A and 27 patients in group B. And 7 patients were excluded because of loss to follow-up. And the group A patients who did receive teriparatide post-operatively and even in the pre-operative period received better ODI scores, VAS scores at 18 months post-surgery. However, more adverse events were seen led to some injection-related side effects in these patients, which were mild and for short duration. In this study, we did conclude that osteoporosis was highly prevalent in patients who underwent fusion for lumbar degenerative spondylolisthesis. An assessment of BMD is recommended in this elderly postmenopausal women to assess the risk of complications in these patients. And treatments with teriparatide calcium supplements had significant improvement in patients' back pain as well as significant reduced VAS and ODI scores. And there is enough research to show supplement this study. There are recent studies published in Spine Journal as well as in Asian Spine Journal, where teriparatide is said to be potentially increase the quality of lumbar spine, bone marrow, and pedicle cortex, and thus reduces the incidence of pedicle screw loosening. And more than 6 months of daily injection facilitates effective bone union following postlateral fusion. So enough literature to support this research question. Thank you.